Researchers at Makerere University College of Sciences say they have recorded success using herbs like ebombo, omutatembwa and kafugangande in the local languages, among other herbs. A PhD candidate in the Department of Chemistry, Madina Adia, has been researching on the phytochemistry and bioactivity of the selected plant species used by herbalists in the treatment of malaria in Uganda. The Deputy Director, Directorate of Research and Graduate Training at Makerere University, Professor Mukadisi Buyinza, revealed this at the Cedar Science Day Research Workshop held at the College of Natural Sciences, Makerere University.
We have documented all the plant species that are being used in the treatment of malaria, and we have tested and selected those that have got the active compounds in the treatment of malaria.
Madina Dia, a PhD candidate in collaboration with herbalists of Karare and Prometra NGOs dealing in herbal medicine, said the trees have been tested, but more analysis are ongoing.
We are yet to determine the safety of these drugs by doing toxicity assays. And when we do the toxicity assays, we come to know are the drugs treating because they treat, or because they have poisonous substances that are treating or even killing the parasites.
Malaria remains one of the major killer diseases in sub-Saharan Africa and is reported to be killing at least one person per every 30 seconds. It infects 300 to 500 million people each year worldwide and killing more than 1 million. A source of various homegrown innovations and technologies, Makerere University is contributing to the fight against the deadly malaria by supporting innovations for alternative ways of fighting the disease.
Good evening, viewers, and welcome to the program. Indeed, what you've been watching is what we are discussing tonight. I'm Dr. Henry Dungu, and tonight we are discussing some of those natural medicines that could be used in treating malaria. With me, I have a guest, Dr. Ogwang Patrick Engeu, who is a pharmacist at Mbarara University of Science and Technology. Doctor, welcome to the program.
Thank you very much, Dr. Dungu.
Viewers, we are discussing herbal medicines. So, you know, sometimes when I talk about herbal medicines, we all think about the traditional herbal medicines that we all know about, our colleagues in herbal medicines or traditional healers. Tonight I have a scientist who is here to talk to us about the work he and colleagues have been doing in trying to find a remedy for treating malaria. But let me not talk for him. Dr. Engeu, or I should call you Ogwang.
Engeu.
Engeu.
Yeah.
Okay.
You know, Ogwang is okay.
Tell us about yourself.
Yeah, I'm called Dr. Ogwang Patrick Engeu. I work with Mbarara University of Science and Technology as a senior lecturer, Department of Pharmacy. My background training is pharmacy, and I specialize in pharmacology at Masters and PhD.
Okay.
And before joining Mbarara University, I worked with Natural Chemotherapeutics Research Laboratory in Wandegia, which deals in research in natural medicines.
Mm.
Yeah, so I'm here to share with you what we have done so far as scientists in this country.
Okay, some of our viewers are actually wondering whether you are not a traditional healer.
Oh yeah.
Are you a traditional healer?
No, I'm not a traditional healer, but I could call myself a herbalist.
You are a herbalist?
All pharmacists are actually herbalists.
What do you mean?
Because we study herbal medicines in school, how to discover them, prepare them, and use them. And I use herbal medicine to treat some of the diseases, actually.
I see.
Yeah.
So, you know, we've had this mentality that herbal medicine is for those other people. So we can consider that as modern medical practice?
Herbal medicine actually is not for the uneducated or for traditional healers. About 25% to 30% of medicines we use are from herbal medicines.
Okay.
Coartem itself, artemisinin component, is from herbal medicine. I have the plant here with me. We have the digoxin, is from herbal medicine.
We use in treating heart failure.
Heart failures is from herbal medicine in natural form, only it's purified.
Okay.
And made in terms of tablets so that they can be prescribed and used. So herbal medicine is for everyone, including the educated scientists,
okay,
pharmacists like me and doctors like you.
Now going back to malaria, In our opening clip, we had a commentator giving us the burden of malaria, but they didn't get into the details. How is malaria a problem in Uganda, if it is?
I think almost everyone in this country, maybe 95%, if you are more than maybe 1 year old, a mosquito has passed near you. And you've heard somebody talking about malaria. In Uganda, malaria is the leading cause of actually sickness and death in children especially.
Okay.
And government, I'm told, Ugandans spend more than 1 trillion shillings every year
on treating malaria.
Treating and preventing malaria. The unfortunate thing that most of that money goes in importing drugs.
Okay.
That means our country is actually losing 1 trillion shillings every year.
Every year.
On malaria. So we need to, that's why we are thinking of coming up with local solutions we can produce here in Uganda to deal with the disease. And I want to share on that, yeah.
I see. So maybe going into that, we all understand now that much as reports show that malaria has come down, it's still a big problem. What are some of the efforts that you scientists have put in place to try to prevent and or control malaria?
Yeah, now we've been knowing that we have measures to prevent malaria, such as using mosquito-treated nets, which are also good. But we found that still there is a gap in how many people can use nets or can access nets. And even when we use nets fairly well, you find that we go to bed around 10 o'clock. People work like, people read like you and me, go to bed around 1 a.m. Already mosquitoes have beaten you anyway. And so we thought about what other measures can we bring on board that can take care of somebody, askari who is guarding outside or a student who is studying. So we thought about coming up with an option which somebody could use, maybe as a tea, and then his immunity or protection against malaria is increased. But that came in also in 2005, when government wanted to use DDT, I think, 2005, and we had problem with organic farmers opposing it. Today, I think I read that they have banned the export of our crops to Europe.
Yeah, there's a temporary ban to that, yes.
Because of pesticides. So because of some farmers were against using DDT. And I remember a farmer from Fort Portal called Monique Endwin, she was a white vaccine in Fort Portal, came to our laboratory one day and told us, but can't you come up with a herbal medicine that can prevent malaria? So then at that time we identified 3 plants. One of them is purple leaves. It's called Carica papaya, purple leaves.
Now you're going to speak. I need to take notes. Carica papaya.
Carica papaya is purple in English, I think. I think we call it a papaya in
papaya.
Yeah. Because its leaves, we know, has compounds that can kill malaria parasites.
I see.
And then the other second plant we thought about was Artemisia. Artemisia annua, which is actually being grown in Kabale.
Those things you talk about, I see you have lots of things here.
Yes.
Which are those?
I brought here, Artemisia is very sensitive to temperature. This is a small weed of it. But on the video clip, we actually have a big plant of it. This is Artemisia annua, a plant from which...
Let me see if we can try put it on focus.
Yeah.
We
get, it's quite tiny. We get artemisinin, which we use to make coatem.
I see. Malaria. Coatem comes from that plant?
From this plant. And this plant is grown in Kabale, Kapchorwa.
Yeah, I see it can be captured so
and
well.
Now even we can actually grow it in lowland area like Nansana. And this plant was used by Chinese for more than 5,000 years before they discovered the compound called artemisinin. Actually, when I was reading, I found that Vietnam-American War, Vietnamese won because of this plant.
What do you mean?
Because in the 1960s, when that war was taking place, there was already resistance to chloroquine, another known anti-malarials, which the American soldiers had. But malaria was killing both the Vietnamese soldiers and American soldiers in the jungles. So the Vietnamese government asked Chinese government for help with malaria, and they gave them this plant here to grow plantations in Vietnam.
The one you call Artemisia
annua.
Annua.
Yes. And we are using it in its crude form, extracting it in ethanol and giving it to their soldiers. And their soldiers stopped dying from malaria, while American soldiers were dying of
malaria.
Because they don't know about this plant here. until 1971, when the chemical called artemisinin was discovered in it, and then the Chinese published it. So this plant is here in Uganda.
We grow it here.
We grow it here in Uganda.
Okay.
So, but there are also other plants we have, like one of the things I talked about, Omutatembwa.
Omutatembwa.
Yes, in English, in botanical language, it's called Xanthoxylum chalibium or Fagara. In our place, we call it Ewusuk in Teso.
So, Fagara, Omutatembwa.
Yes.
In Iteso, you call it what?
Ewusuk.
Ewusuk.
Yes, I think the Teso are listening know that there's a plant called
Of
Ewusuk.
course, people from Soroti and every part of Teso.
Yes. When we are growing up,
WBS.
Ewusuk was our medicines at home. And another one here called Wabugia ugandensis, called Abach. These were medicines that...
Wabugia.
Yeah, Wabugia.
Mm-hmm.
I remember when we were growing up, if you developed a fever, mother would just get somewhere in the house, pick the bark, scrap a little bit of it and boil it, and then give it to you.
And you feel good.
And after 3 days, you are going back to school. But we neglected them because we think we're educated now. We don't want to see leaves. We don't want to see trees around us. We want tablets. But tablets come from those things. So in 2008, 2006, because of DDT, we thought about a solution, natural solution. And then there were two farms, one in Entebbe, flower farm in Entebbe called Wagagai, and then Finlay's Tea Estate in Fort Portal. They had a burden of malaria, and they are willing to try any herbal medicine for prevention. So they requested us to study this herbal medicine in their population, because they wanted to start taking them as a group of farmers. And then in 2006, we conducted an observational study where we followed those who are using this tea made from Artemisia, that plant Artemisia.
So there was a group of people,
Farmers
who are using Artemisia.
Who began using Artemisia
as a tea?
As a tea.
Knowingly or unknowingly?
They knew that Artemisia was a plant Chinese used for many years. Now that we are growing it here, they decided to use it, to take it as a tea and see if it can help them against malaria. But then there was no scientific data. So I began following them in 2006, actually January. Those who are using this tea, because there are some people who are not using it, it's another group that was not using it, for 6 months. I was surprised by what I saw.
What did you see?
Malaria in the users had dropped by 80%. They were just taking this tea once a week. 80% reduction. That time I wrote a report to the managers of the farm, the two farms, and I wrote a report to our director, Natural Chemistry Laboratory at that time, indicating that this plant here has capacity to reduce malaria burden by 80%. And then, of course, we always have gaps in doing research in this country.
I know.
So one time I was called to go and make a presentation in Rwanda on the same. While I was in my office preparing the presentation, an old man called Enoch Ndiabanawe from Kabale walks into our laboratory, our office. He used to do research on avocado, in avocado seed. He was trying to make it into a beverage for people to take and so on. So when he saw the paper I was preparing, he saw graphs. He's not a scientist per se, but an observant old man. And he said, what are those graphs? I'm like, this plant here can actually reduce malaria burden in this country. You know, like, so why don't we make it into a product, tea, which Ugandans can take? So then at that time, we combined efforts with him, but we didn't have sufficient funding. However, he told me to write a proposal so that he can go to government offices, different government, to look for money to fund that work, because he saw it as a noble idea. And this man went to different offices in this country. But I want to thank the former director then, Dr. Zamzaram, the Director General of Health Services. He was very positive. He gave us letters of recommendation.
Okay.
Which this man walked with to the office of the Deputy Secretary to Treasury. That time was Mr. Keith Mwakanizi.
Yes.
I also want to thank him very much. Because when Keith Mwakanizi received our proposal, he read it and he saw our dream. And he recommended us to go to National Council for Science and Technology so that he can be briefed on the science behind our work. National Council for Science and Technology called us to present our scientific work for defending it. We presented the proposal, we defended it. There are several groups, and I'm proud we emerged the best group among those who presented for funding.
Wait a minute. We've had this gentleman come to your office. You're writing your paper.
Yes.
he picks interest
in it.
You combine ideas. You've written a proposal.
Yes.
You are sending it now to
look for money. Yes.
Let's go for a break. When we come back, we are going to continue this discussion on how this natural product is turning into a medicine that might reduce or reduces actually malaria by almost 80% when we come back.
Load the airtime knowing it's easy. You get it all back with cheesy. On the airtime